Hello and welcome back to VetCare. Today we're talking about sepsis, septicemia, and viremia, serious health conditions in animals that involve infection spreading through the body. Let's begin with sepsis. Sepsis means there is a confirmed bacterial infection, along with the presence of systemic inflammatory response syndrome, which is defined as the body's strong response to injury or infection. It can be caused by infectious agents such as bacteria, viruses, protozoa, fungi, or non-infectious causes like trauma, burns, toxins, or high body temperature. When sepsis is present along with organ failure, it is called severe sepsis. If severe sepsis also causes hypotension, blood pressure below 65 mm of mercury, even after giving fluids, it becomes septic shock, a life-threatening emergency. Now, let's look at the difference between septicemia and bacteremia. Septicemia means bacteria are actively attacking the bloodstream and causing sepsis or septic shock. Bacteremia, on the other hand, is when bacteria are present in the blood but without causing any sickness. In septicemia, the pathogens stay in the blood for a long time and cause signs like fever, fast heart rate, low blood pressure, and even organ failure. In bacteremia, bacteria are in the blood only for a short time, often without any symptoms. Septicemia is dangerous and can be deadly if not treated, while bacteremia is usually harmless and goes away on its own. Septicemia is very common in newborn farm animals that do not get enough colostrum within 24 hours of birth. Bacteremia can happen after small procedures like rectal exams but usually has no effect. Viremia is when viruses invade the blood and spread through the body. These viruses settle in different tissues and cause damage specific to the virus type. Let's talk about the etiology of septicemia. It can happen due to specific diseases like hemorrhagic septicemia, pneumonic pasteurellosis, anthrax, salmonellosis, leptospirosis, colobacillosis, and listeriosis. It can also happen from suppurative infections, which are infections that form pus, such as metritis, mastitis, arthritis, endocarditis, pericarditis, pneumonitis, or ruptured abscesses. Some animals get secondary septicemia because their immune system is weakened by other health problems, like diabetes, kidney failure, viral infections, or other conditions that affect the immune system. Let's move to pathogenesis. Septicemia starts when pathogenic organisms multiply in the blood and release endotoxins. The resulting clinical signs are caused not only by these toxins but also by damage to the body's own cells and tissues. The organisms may directly invade tissues, causing local or widespread bleeding. Other organisms impair the blood clotting system, leading to either intravascular clotting, clots in vessels, or severe hemorrhages, which can be fatal. Long-term septicemia depresses the hematopoietic system, resulting in severe anemia and other cardiovascular defects. Let's now look at the clinical signs of septicemia. The primary sign is the development of high fever 106 to 108 Fahrenheit, shock, and bleeding under the skin or mucous membranes, most noticeable in the conjunctiva and oral mucosa. Other signs are anorexia, loss of appetite, constipation or diarrhea, lethargy, depression, and decrease in milk production. In chronic cases, severe emaciation, cachexia, anemia, and evidence of cardiovascular or respiratory failure may be evident. Next, let's discuss clinical pathology. A blood culture before giving antibiotics helps identify the bacteria causing the disease. A CBC test shows immune changes. In peracute stages, you may see leukopenia. In acute or subacute cases, there's leukocytosis with a left shift. In chronic stages, you may also find anemia, hypoglycemia, and high blood urea nitrogen. On necropsy, we usually see congestion in organs like the spleen, liver, and lymph nodes. There may be hemorrhages under the skin and in muscles, especially in the heart. Other signs depend on the exact cause of septicemia. Let's now talk about differential diagnosis. If you see signs of toxemia, bleeding in many tissues, and find bacteria in the blood, it strongly points to septicemia. Heatstroke can look similar because of the high fever, but it usually happens only in hot, humid weather and there are no bacteria in the blood. Now, let's talk about how to treat it. Start with specific treatment. Use broad-spectrum antibiotics like neomycin, gentamicin, or penicillin in high doses by injection. Once you know which bacteria are causing the infection, change the antibiotics if needed. You can also use hyperimmune serum or antitoxins to help fight the infection, if available. Next is symptomatic treatment. If the animal has a high fever, give antipyretics and use cold packs to cool the body. If the temperature is above 107 degrees Fahrenheit, this should be the first step. Finally, supportive treatment. Give the animal fluids, vitamins, minerals, amino acids, blood, or plasma. These help support the body, especially during the recovery or healing stage. If you found this video helpful, please like, subscribe, and click the notification bell for more VetCare updates.